Hey, Margie here. Unfortunately, there are some common medications that many of us use that can increase bone loss and be a root cause of osteoporosis. And oftentimes, we're not even aware of it. So, in today's episode, what I'm going to do is share a fabulous interview I did for one of my summits with Dr. John Neustadt on this very important topic. And Dr. Neustadt was the founder of Montana Integrative Medicine. He's the founder and president of the dietary supplement company Nutritional Biochemistry Incorporated, NBI, and of NBI Pharmaceuticals. He hosts the Delivering Health podcast and is a member of the Bone Health and Osteoporosis Foundation Corporate Advisory Roundtable. He's written books, dozens of articles on osteoporosis, and over 100 research reviews. He was recognized by Elsevier as a top 10 cited author in the world for his work. His latest book, which I absolutely love, Fracture Proof Your Bones, A Comprehensive Guide to Osteoporosis, recently came out and is filled with so much information that we can all put into our lives. But today in this talk, he's focusing on the medications that can increase your risk of osteoporosis and what you can do. So it's filled with lots of great information. So stay tuned. So welcome, Dr. Neustadt.
Thank you so much. It's nice to be here and the opportunity to share this information. Thank you for that.
Well, let's just dive into this topic of medication-induced osteoporosis and how big of a problem is it?
It's a huge problem. A lot of people are taking medications. In fact, people 65 years and older, about 50% of them are taking 5 medications at the same time, and 12% are taking 10 or more. 74% of physician visits involve a prescription. So I'm sure all of your listeners either are taking a medication or have friends who are taking medications or family members who are taking medications. Unfortunately, what started to emerge in the research and become more understood is how a lot of medications impact bone health and muscle health as well, to increase osteoporosis risk and increase risk of falling and increase fracture risk. So a study was published a few years ago, and they looked at Medicare patients who had fractured, had a hip fracture or a shoulder fracture or an arm fracture. And what they found is that 76% of those were taking one or more non-opioid medication prior to the fracture. So those medications were specifically medications. 76% of those people were on medications that specifically increase fracture risk. And 56% of those patients were on a medication that increased fall risk. So after that, you'd think, and I would hope, okay, somebody comes in with a fracture, they have osteoporosis, they are on medications. Well, of course, the doctor's going to know. They'll look at the medications and they'll lower the dose, or they'll have a discussion with me and see if we can switch medications or maybe get off of it. But what happens is many doctors themselves, unfortunately, aren't aware enough of the whole list of medications that cause problems. So what they found in this study is that after the fracture, all those people that were taking medications that increase their fracture risk, increase their risk of falling, they had a fracture, they got their medications reviewed when they went in to see the doctor and get treated. The people who were then switched medications, they were given a different medication. What happened is overall, there was no change in the number of people who were on medications that increase fractures or increase falls, because they were switching them to medications that actually did the same thing, maybe different mechanisms, but increased the risk of fractures as well without knowing it.
Wow, this is so important because people think they need this and we're going to go into the specific medications, but that's the thing everybody's worried about, a fall and a fracture, which can totally change your life. And yet it could be, part of the problem is some of the medications that we're all taking. So that's
oftentimes it's not even evaluated for that risk. The medications are not evaluated. The doctors will talk about the potential side effects, and rarely is osteoporosis or increased fracture risk part of that discussion. And so it's really important for people to, I think, ask that question specifically. Do you know, does this medication affect my bone health? Could it impact my risk for falls or fractures? And I really recommend that people really befriend their pharmacists. Pharmacists are amazingly well educated. They spend a lot of their days just filling prescriptions, and yet they have the best knowledge of any healthcare provider about the medications. And so I really recommend people talk to their pharmacist and ask them. And the pharmacist has easy access to databases where they can quickly go check if they don't know the answer. And so not just asking your doctor, but have a conversation with the pharmacist as well.
Wow, that's just unbelievable that they won't tell you. I never really thought about that they're not going to say, this could increase your risk of fractures or falls. And
Well,
that's,
I don't think it's out of, I don't think it's malicious. I just don't think they
yeah,
know.
yes.
They're just, it's not aware of it.
Well, that's part of the summit to really increase awareness of all these things so we can prevent them. So let's get started. Why don't you start with let's just go through the medications that put people at risk for fractures.
Sure. So let's start with the antidepressants, because I think that everybody knows about antidepressants. Well, I think everybody knows about most of these medications, but 25% of women 60 years and older are taking an antidepressant medication. And I don't think many of them, or most of them, are probably aware of that it does increase the risk for fractures. So there are two different categories of medications depending on the mechanism of action. So there's the selective serotonin reuptake inhibitors, that's Lexapro, Zoloft, Cymbalta. Then there's the selective norepinephrine, serotonin and norepinephrine reuptake inhibitors. Both of those have been shown to reduce bone density and increase fracture risk. They've been associated with both of those. Now, I've had conversations with doctors and patients that I've worked with, and I've said, and I hadn't prescribed the medication. I said, go back to your doctor, because the only thing that's changed since the last time you got your bone density test was you started taking this was an SNRI medication, was that you started this medication. So go back and talk to them, because both of those categories, the SSRI and the SNRI, and it can get a little technical. So all you've got to remember is serotonin. If anything affects the serotonin, it potentially can create a problem. In the US, a lot of more doctors are aware of that. The Lexapro, the Zoloft, those SSRIs will affect bone health, but fewer are aware that any medication that affects serotonin will affect the bone health. Because this patient came back and said, well, my doctor said this category of medications, the SNRIs, don't affect bone. And there's actually a Canadian study published that show they do. In fact, with the serotonin antidepressant category of categories, both of those, for every one additional patient taking there'll be one additional fracture for every 19 people taking these drugs.
That's tremendous. Wow, that's very upsetting. Oh my.
And like with a lot of medications, the longer people are on the medication, the risk accumulates. So what happens with these medications is serotonin, a lot of people have heard of for depression, brain health, mood. But what a lot of people don't realize is that most of the serotonin, 80+% of serotonin, is actually produced in the gut. Our cells in our intestines produce most of the serotonin, and it has effects. There are serotonin receptors, has effect on cells, not just in the gut, but in the bone as well. So when you artificially increase the serotonin with these medications, you're not just affecting the serotonin in the brain. Serotonin accumulates in larger amounts in the bone. And the effect that it has on the bone is it decreases osteoblast activity. And osteoblasts are the cells that produce more bone. And it increases osteoclast activity. Osteoclasts are the cells that break down old, worn out bone. And we need both. We need for a healthy bone. You need a healthy balance of both. You need healthy osteoblast building, more bone, and osteoclast, chomping. I think of Pac-Man because I'm in that age group with I played Pac-Man as a kid. Yeah,
Oh,
Pac-Man
me too. I get this.
Chomping that old bone and breaking it down, and the osteoblasts are coming in and they're building new bones. So you get this good, healthy bone matrix, strong bone matrix. And when that balance is disrupted, that homeostasis is disrupted, it creates problems. And a lot of these medications, the serotonin type antidepressant medications, have a similar action that other medications do as well. They slow down or stop the osteoblast activity, and they increase the osteoclast activity, possibly through different mechanisms, but the overall result is the same. Tricyclic antidepressants, another category of medications, have not been shown, are not associated so far with reduction in bone quality, quantity, or increased fracture risk. So if they have to be on an antidepressant, tricyclic antidepressants may be a better choice if they're worried about their bone health.
And do you want to clarify what would that, like what are the typical names of those?
Oh goodness, I don't remember all the brand names of the drugs. I really don't prescribe medications.
Got it.
And so the common names of a lot of the drugs, unless they're, I hear them or have conversations about them frequently, they're just not at the tip of my tongue.
And I think the interesting point is so many people, that's the first line of defense. Oh, I'm feeling sad, or I've gone through a stressful situation. Antidepressants. And as you said, 25%, but I see so many young people, so many young women, especially on antidepressants. And what's your thought about that?
I think that a lot of times they're overprescribed, like a lot of medications. My opinion is medications are too often used when there are potentially other very effective, scientifically, rigorous studies showing that other things can work. So with depression, for example, there's situational depression, which maybe it's just something going on in someone's life, and hopefully that's being addressed through speaking with a psychologist or social worker, or working on personal development, working with cultivating happiness and joy in your life. Things like that are so important to not just mood, but overall health in general. But when you get into things that may be going on physiologically that create depression, there's a long list. If somebody comes into me and says, I'm depressed, automatically there is a long list of questions that I have. So is their sleep okay? So sleep and depression are intimately linked if someone's not getting adequate sleep. Are they exercising? Exercise helps, it releases endorphins, and endorphins help make people happy. Are they doing what they're intended to do with their life? Do they feel stuck? That's situational kind of depression. Biochemically, though, especially with women who are at high risk for iron deficiency because of their periods, iron deficiency creates depression. And so the most sensitive test for that would be the serum ferritin test, to look at whether or not they have enough iron. So that's one thing. Deficiencies in any of the essential amino acids have been associated with depression. So that would be, tyrosine, tryptophan, valine. There's a list of them. Deficiencies in magnesium. So different nutritional deficiencies. Chronic inflammation has been associated with depression. And so that's, from a holistic point of view, that's how I would evaluate and think about depression, and working up somebody with depression before recommending right away they go on an antidepressant. Except, and here's the caveat, if someone is suicidal, if they have suicidal ideations and it feels like a really serious possibility, then I recommend they get on a medication immediately. Now, it'll take some time for that medication to take effect, but we're starting the process while we're also evaluating the other things. So I actually had a patient years ago with severe postpartum depression, and I had her go on an antidepressant right away while I ran testing, blood and urine tests to look and see if she had any of these deficiencies and more that I haven't even discussed. And she did. So as soon as we gave her and replenished her with the things that her body was missing, her mood went up. Having a being pregnant is a risk for nutritional deficiencies, because that fetus, that little baby, growing inside of you is taking all of your nutrients. And so it's not uncommon for people who, after they're pregnant, to be at a higher risk for those deficiencies. So there are wonderful tests that can see if somebody is deficient, and then the body is primed. Once you give the nutrients for the body to work, for our biochemistry to work, like gas in an engine, it just runs right. People start feeling better when that's the underlying cause. And unfortunately, that's a huge piece of the puzzle that is most of the time missed when people are being evaluated for depression.
No, it's so interesting because part of the summit is looking at root causes for bone loss and osteoporosis, but this is taking it another level where depression and stress and cortisol, all of that can affect bone loss. But let's go deeper and see what's causing that and what are the imbalances. And I truly love your approach. Now, what happens when someone comes to you who's been on the medication for 10 years? Do you gradually decrease it? Or someone who's listening and say, oh, well, I've been on this, for years. What's your thought on how you transition away from that?
So it depends on the medication itself, right? So medications have what's called a half-life. And that is how long does it take for half of the medication in your body to break down and be gone, right? So I always look at that and say, okay, what's the half-life? And step people down off their medication very gradually. But first of all, especially with depression, I don't make any changes to any medications for weeks. So once they're evaluated with this approach, once they're treated with this approach and being followed with regular follow-ups, typically once they start their program, and this is in my first book and in my textbook, I wrote about this, after 2 weeks, they come back and check in, just a quick check-in. And then 4 weeks later, these are 3-month programs, 4 weeks later, they, a longer appointment, I would expect somebody to be feeling much better by that point. I want them stable and feeling good for at least 6 weeks before we start tapering down on the medication. And then it's very slow. Now, some medications, antidepressant medications and other medications, coming off of them may create side effects. Dizziness, for example, is one. But so in those cases, it's been very rare. Intravenous nutrients like a Myers cocktail has been very helpful for those patients in helping them deal with those side effects and reduce those side effects. Now, if there are no studies on that, this is nutritional medicine that I'm talking now, that's practiced in the integrative medicine world, in which I'm, immersed and from which I come. And I can just tell you my own personal clinical experience and anecdotes. This is the approach, and this is what works in terms of the association of nutritional deficiencies and depression. Now, that's not my opinion. That's all in the literature.
Yeah, that's such a good point, because sometimes someone will get dizzy and they're like, just go back on your medication. So I think that's great that you brought that up, that there's ways to handle the side effects so you can continue to move on with your program of, getting off the medication. Okay, so are we ready to go to the next? That's so important. I really believe most physicians do not really tell people about the side effects of bone loss and fractures with the antidepressants. So that's so important that you brought that up. Is there anything more you want to share on that before we move to the next medication?
Just one, which I think is one thing, which is an overall statement with medications. I really encourage people, if they're recommended a medication, or even a dietary supplement from a practitioner, anything. I think an important question to ask is, how long will I be on this? So a lot of people don't ask that. And with the antidepressants and many medications, most of them, in fact, except for ones that have, short-term courses like a course of antibiotics, the intention is that people will be on them indefinitely. And again, the longer people are on a lot of these medications, the greater the risk for problems. Acid blocking medications, which we can slide right into that one as the next group of medications, is a great example. The research has shown that the proton pump inhibitors, that's like, Protonics, Nexium, those type of the little purple pill, those acid blocking medications, first of all, were never intended and approved by the FDA for long-term use. So if you read the box in the drugstores in the store, it says, I believe, not intended for longer than 14 days. And so they are used clinically in certain situations are important, like H. pylori treatment, Zollinger-Ellender syndrome, erosive esophagitis. 50% of those medications are prescribed for acid reflux. And when people are on that for acid reflux and for some other conditions, they're taking them every day for years and years and years, not understanding that the research has shown that after 4 years, there's an increased risk of hip fracture, the most dangerous fracture, by 60%. And that's just one of multiple studies that have come out and been done. Now, the other category of acid blocking medications, the histamine 2 receptor antagonists, and I do have a couple of those names, Tagamet, for example, or Pepcid AC, those have not been associated with fractures. So in terms of bone health, those seem to be safer if somebody does need to be on an acid blocking medication long term. But again, like the antidepressants, if you think from an integrative medicine perspective, a natural medicine, nutritional medicine, there are really effective ways, especially with acid reflux, which again are half of the prescriptions for proton and pump inhibitors or for acid reflux, that of dealing naturally with acid reflux. So I'll give you a couple examples. One is if somebody has a food allergy, that can create acid reflux. If somebody has a H. pylori infection, a lot of people don't know it, that can create acid reflux. So if people are eating, there's certain foods, 5 foods that increase and create acid reflux in certain people. It's tomatoes, raw garlic and onions, citrus, chocolate, and coffee. Some of my favorite things, unfortunately. So just changing your diet sometimes can be very helpful and effective. But the acid blockers, they do a little different mechanisms than the antidepressants because those can actually deplete nutrients, right? So they've been associated or shown, people taking acid blocking medications, the PPIs, have been shown to have it depletes magnesium, vitamin B12, lower ferritin. I mentioned ferritin before. That's that storage form of iron. And so at the very least, if somebody needs to be on long-term proton pump inhibitor treatment, supplementing with those nutrients or testing for those is, in my opinion, important. Just a quick note on the testing. Conventionally, a doctor will test for magnesium, serum magnesium, right? That's great for emergency medicine. That's great to see if you're going to have a problem with your heart, but that's not the gold standard for nutritional medicine to see if you have enough magnesium for your cells to be operating. The body uses magnesium for over 350 different processes. And over 50% of the US population don't even consume in their diet the minimum recommended daily amount of magnesium. So a lot of people are walking around with suboptimal magnesium levels anyway. And then if you add a proton pump inhibitor or a medication that depletes that magnesium even further, it's not good. So the gold standard in nutritional testing for magnesium is what's called the intracellular or the red blood cell or the erythrocyte minerals test. Those are all 3 different names that it could go by. And that'll tell you, do you have enough inside your cells for them to do their job? That's great that you explained that, because a lot of people, oh yes, the blood work said my magnesium's fine, but yet it's not really indicative of what's really going on. So Correct. Thank you for clarifying that. So let's just go back now, because people are listening and they're thinking, okay, I'm just going to go right off my PPI. What's your suggestion on
when people are thinking, oh, I've been on this for 4 years, in terms of tapering off, how do you work with people or recommend to that people who are on PPIs?
Well, first of all, my recommendation is that they work with somebody who can evaluate them holistically, or they can identify the underlying cause and get on a plan. So doing this by themselves can be challenging, because unless they're actually changing things to address the potential underlying cause of what was bothering them to begin with, that acid reflux could come roaring back. And if it does anyway, then you're working with somebody who has a perspective to say, okay, we've tried X, let's look at Y and Z now, because not everything is going to work for every person. It's individualized medicine, individualized approaches. Now, the acid blockers are a little bit different than the antidepressants. You don't really have the risks associated with coming off of them faster. So I'm not so concerned with somebody coming off of the acid blocking medications faster than, let's say, the antidepressant medications.
Okay, great. And I think it's so important to look at root cause. And the good news about that is when you do, like, people just think they have to live with this. Oh, I have heartburn, or, oh, I have this, and they just accept it. I can't believe how many people I see who just accept it as part of their life. And, oh yeah, I'll just, take the Tums or take whatever when I need to. But as you say, you can get to the root cause and figure out a solution. So that's really exciting. So any other categories you want to share that really contribute to bone loss?
Yes, I would say the aromatase inhibitors that's important. That's part of typically breast cancer treatment, especially estrogen positive breast cancer treatment. And that strips the bone. It blocks that aromatase enzyme from creating more estrogen. And that then depletes bone mineral density, increases the risk for fractures. And so that's really important. If somebody is on an aromatase inhibitor, they really should have a baseline bone density test result done. And that's oftentimes missed. So making sure, if they're going to be going on an aromatase inhibitor, making sure that they do get that bone density test when they start or before they start, and then having repeat bone densities to test their bone density numbers and seeing if it's going down is important, and talking to their doctors about whether they should be going on a bisphosphonate medication or another type of osteoporosis medication. In that case, I think it's an important conversation to have, as well as pursuing all the other natural integrative approaches that we know are so powerful at reducing the risk for falling, which is 95% of fractures occur because of falls, and growing stronger bones and reducing fracture risk. So that's really what I would say about the aromatase inhibitors. The other ones I'd really want to mention if there's time is the glucocorticoids, prednisone, dexamethasone. They're powerful anti-inflammatories. They're used for rheumatoid arthritis, asthma, chronic rashes, those sorts of things. They increase long-term use, increases the risk of fractures by up to 200%. And up until recently was thought to be the only risk was long-term use. Now we know there's a 2017 study that came out that looked at short-term use, those dose packs that people may have heard of. They're on for maybe 7 days or 5 days. They get tapered down. Even those short-term, now we know, increase the risk of fractures in the 30, 60, and 90 days following that, taking it. Now, the fracture risk goes back down over time, but it is a risk even with those, even with smaller doses and shorter term use. It's important with long-term prednisone use, which a lot of people are on, to understand that a bone density test, I mentioned that with aromatase inhibitors, like anastrozole is an aromatase inhibitor, that to get a baseline bone density test, when people are on glucocorticoids is not really that helpful, because the increase in fracture risk with prednisone and dexamethasone and these other medications occurs even before bone mineral density starts to decrease. And that's because bone is more than just its minerals. In fact, a bone density test only predicts 44% of women who will break a bone and only 21% of men. So those glucocorticoids are damaging the bone and increasing the risk for fracture by other mechanisms besides just depleting bone density. And one of those mechanisms doesn't have anything to do with the bone itself. Those glucocorticoids actually damage muscle. They damage and they weaken the muscle fibers. And so they increase people's risk for falling, as well as damaging bone.
Wow. So what is your suggestion on that? I guess fine. Well, you can tell me what do you sometimes people have to take that, but do you try to get people off that and find other treatments?
Ideally, of course, ideally.
Yeah.
And this is where I think it's super important to work with a naturopathic doctor or a functional medicine doctor who's they're trained in these integrative approaches, these ways of thinking, these ways of testing, to see if it's possible to reduce that medication or help you taper off of that altogether. If somebody's on them, then I think the basic foundational approach holds for all of these medications. A good whole foods diet, a Mediterranean style diet, has been associated with a decrease of 21%, a reduction in hip fracture risk. Balance exercise, strength exercises, making sure people are getting enough sleep, and also dietary supplements can be very helpful in many of these situations. Calcium and vitamin D. But beyond that, there are clinical trials actually, and some of these medications with a specific form of vitamin K2 called MK4, 45 milligrams a day, that specific amount shows that it stops and reverses bone loss in these clinical trials with people on prednisone and even kids on prednisone. There have been multiple clinical trials with glucocorticoids. There's a clinical trial with another category of medications called androgen deprivation therapy. Those are leuprolide, and that's used oftentimes for prostate cancer. It's also used for some gynecological conditions sometimes. It stopped and reversed bone loss in the MK4, 45 milligrams a day there as well. And in postmenopausal osteoporosis, there have been 25 clinical trials. 5 of them specifically looked at fractures, and repeatedly it's been shown to stop and reverse bone loss. But more importantly than just bone loss, as indicated on a bone density test, the MK4 in that dose has been shown to reduce fractures by 80% or more. So that's kind of the more holistic approach that I take, whether they can get off the medication or not. They're just very specific things that people can do, supported by the research, supported by the medical literature, shown to help them reduce potentially the risks of this particular side effect from these medications.
Wow. We can talk. Are there any other ones? I don't want to miss anything, but I know we could talk for so long. Was there anything else you want to share? Because I certainly don't want to.
I do want to just mention as a caveat,
Sure,
that the dietary supplements, they are supplements. They're not medications. They're not intended to replace a medication. And in fact, if you look at every dietary supplement website, it says, this information has not been reviewed by the FDA or approved by the FDA. This product is not intended to diagnose, treat, prevent, or cure any disease. So what I like to do is share what's in the research and then tell people that medical conditions, look, take this to your doctor, see if this is right for you. Because there are some contraindications to taking even nutrients. If somebody's on warfarin, for example, a blood thinner, they should not take that high dose of vitamin K. It antidotes that. So understanding that, working with your doctor, I think are 2 important things to do.
I think that's such a good point, because a lot of times people just say, oh, I heard this, I'll take this, or I'll do this, or this exercise worked for this person. And I think you make such a good point that everything's individualized and you really need your whole team working with you to figure out the best plan. That's the safest plan as well as the most effective. So this has been really great. Any last minute things that you want to share?
I just hope people who are listening to this and watching this are lifelong learners. And if they're not, they become lifelong learners, because there is so much to health And you're doing such an amazing service by putting the summit on and inviting people on to interview them and share their knowledge. And I hope that I've been able to impart some helpful information to people today that can help them improve their health, or those of a loved one. So thank you for the opportunity for me to share what I've learned.
I hope you enjoyed my interview with Dr. Neustadt and now have a better understanding of some of the medications that can be contributing to bone loss and osteoporosis. Knowledge is power. So I hope you take this information and just look at your life and your medications and see, is there a way working with your healthcare provider that you can either reduce the medication or look at some other options like Dr. Neustadt talked about. The links to Dr. Neustadt's book and his website will be in the show notes, as well as the link to my free mini course, Improve Your Bone Health Naturally. So I hope you take advantage of that as well. So thank you so much for tuning in, and I look forward to seeing you on the next episode.